Hello, welcome to the Chris Davis Show. I'm your host, Chris Davis, and today we're going to talk about uh, the American Health Care Act. It just passed the House today. It just needed 216 votes to pass, but it got one more above what it needed, 217, and it has passed the House. After three tries, the GOP finally got it, three times the charm. So I bet you're all wanting to ask me is what revisions is in this bill this time? It failed 6 weeks ago. It failed a week ago. Um, what changed to make it get passed? Like, how did it get passed after it failed twice? Well, their bill still keeps everything in it as before, but it has once again another small revision. All right, so in the bill, what it has is states can still apply for waivers on regulations. So that means insurance companies can charge people more with pre-existing conditions. They can decide which of the 10 core healthcare benefits are essential to cover. Um, Trump's plan is to get rid of the income-based tax for a flat tax, which will wind up charging older and sicker people more. It's going to get rid of the Affordable Care Act mandates. So that means your employer doesn't have to provide you health coverage if they don't want to. Um, and the revision that they made in there, it says that $8 billion will be given to states over 5 years to help pay for people with pre-existing conditions. Now, a lot of people have come out, medical organizations and organizations that are not affiliated with political parties have stated that this won't be enough to pay for people with pre-existing conditions. It's not going to be enough. According to Karen Pollitt, senior fellow at the Kaiser Family Foundation, you just won't cover many people with $8 billion over 5 years. The American Medical Association tweeted out, "Contact your reps now. Tell them to vote no on the Affordable Care Act replacement. Millions would lose coverage if passed. Without health coverage, millions of American families could be just one serious illness or accident away from losing their home, business, or life savings." So, a lot of medical organizations have come out to say that $8 billion will not be enough to cover people with pre-existing conditions. Jimmy Kimmel even gave a heart-touching speech about this subject. All right. House Democratic leader Nancy Pelosi has criticized the GOP's bill because they passed it without without the Congressional Budget Office looking at it. So she states that no one really knows how much it's going to cost and how much it's going to affect premiums and how many Americans are going to be covered under Trump Care, or what they like to call it, the American Health Care Act. Even though this bill has passed the House, it's not a law. It still has to get past the Senate. All right, and the Senate has already started tweeting out statements. There is three senators, Rand Paul from Kentucky, Mike Lee from Utah, and Ted Cruz from Texas, all tweeted out that they would oppose anything short of a full repeal of Obamacare. They also said that the House bill's tax credit structure helped people pay for coverage amounted to a new entitlement. So this bill is going to be scrutinized by the Senate. I don't know whether or not it's going to pass the Senate or not. All right, but they passed it through the House. That is a huge accomplishment. Well, to me, this bill is not better than like the Affordable Care Act. With all like the waivers and the tax cuts, you're actually paying more for like less coverage. And the Affordable Care Act wasn't perfect. As I said in my last video, just the law itself was causing premiums to um, raise to go higher. Premiums went higher because of the law itself. It said that insurance companies must provide health coverage for everyone. So since insurance companies have to cover all these people, these premiums are going to go up. They're going to go higher because we have to cover more people. Insurance companies pulling out of states until there's only like one insurance company left in that state. They have a monopoly, so they can set the price as high as they want because there's no competition. All right, that also causes premiums to go higher. And not most, but enough people, instead of signing up for the Affordable Care Act, they went on and paid the penalty because the penalty was cheaper than signing up for the Affordable Care Act, which also causes premiums to rise because those people are not helping to fund the Affordable Care Act. So there, the Affordable Care Act is flawed, and I would have liked more from Democrats or maybe even from Republicans just to tweak it and fix the premiums, like I mentioned in my last video. But that did not happen, so the American Health Care Act passed through the House. And so we've talked about the Affordable Care Act, we talked about the American Health Care Act. Why don't we talk about something else? Let's talk about single payer, okay? What you're asking me right now, what is single payer? Well, it's Bernie Sanders' law. It's also called Medicare for All. So, what is single payer healthcare? So, according to PNHP, single payer national healthcare insurance, also known as Medicare for All, is a system in which a single public or quasi-public agency organizes healthcare financing, but the delivery of care remains largely in private hands. So, what what is in single payer? According to healthcarenow.org, everyone will receive comprehensive healthcare coverage under single payer. Care will be based on need, not ability to pay. Employers would no longer be responsible for healthcare cost coverage decisions. So that means your employer would no longer have to pay for like your health coverage. Taxes would be raised on lower class, middle class, and upper class. We would pay the government, and then the government would pay for the health coverage and stuff. With your employer paying for it, he or she just takes it out of your paycheck to help pay for your health coverage. That's what they do. So, what are the downsides to single payer? What are the downsides? Well, if you're in America, if you've just been following the issues, there are people who believe that health coverage is not an entitlement. It's not a right. You have to work for it. And they don't believe that the government should dictate to who the government does not get the so there's people who think that the government does not decide who gets health coverage and how. They don't believe that's the government's place. That they believe that's the individual's decision. Okay, so the downsides to single payer is that the bureaucracy would increase. It would get larger because we would need to hire more government employees to help with the financing. Doctors would become government employees. They'll do the care. They would still deliver the care, but the government would pay them. And so there's like researchers who say that they would be paid even less, which would disincentivize people from pursuing the medical field. It would de-incentivize research, breakthrough research, since there's no profit. So that's really the biggest downside. People will not really pursue the medical field because they can't make as much as they would in the private sector and the multi-buyer market and the multi-buyer system. So those are the downsides to single payer. But let me know in the comment section below. Are you happy that American Health Care Act got passed in the House? Do you think it will pass the Senate? Do you want it not to get passed in the Senate? Do you want to keep the Affordable Care Act? Do you want to support Bernie Sanders' single payer Medicare for all? It does have a 60% approval rating, so that's more than half the country approving of it. Let me know in the comment section below, and all of you have a great day.